The International Code of Marketing of Breast Milk Substitutes, also known as the WHO Code, is an international health policy framework for breastfeeding promotion, adopted by the World Health Assembly (WHA) of the World Health Organization (WHO) in 1981, including strict restrictions on advertising.
Baby milk, infant formula, growing up milk, follow-on formula, mummy milk. You have probably seen them all in your local store, on TV, in social media, or even in your health facility. They tell you your baby is going to be intelligent, happy, strong, and healthy. But did you know that marketing of these products is prohibited in most countries? Let's be fair. There are several reasons why some babies cannot be breastfed. Substitutes should of course be available for those who need it. However, it should not be pushed on those who don't need it. Why? Scientific research proves that breastfeeding is the better option for a baby, especially in countries where bottle feeding is hard to keep up to hygienic standards. Take a look at these figures. For a child who is not breastfed, the risk of dying from diarrhea is 5 times higher compared to a breastfed child. And the risk of dying from pneumonia is 9 times as high. In fact, the number of deaths for children under 2 years old could be reduced by 823,000 every year if children were breastfed. Most of the deaths occur in low and middle income countries.
By using infant formula, it puts them at greater risk of getting sick from diseases found in water. Therefore, children who are fed infant formula often are at a greater risk of ear infections, of colds, of fevers, and when they do get sick, they're often sick for a longer period of time.
Did you know that breast milk substitutes are subject to international regulation? In 1981, the World Health Assembly adopted a set of rules designed to restrict promotion of breast milk substitutes. Under the regulations, companies are not allowed to offer free samples to healthcare professionals, and healthcare professionals are not allowed to offer samples to pregnant women or women with small children. No healthcare center is allowed to display products, advertisements, or commercial information from the manufacturer, nor is it allowed to advertise or promote products in stores or in public spaces, conduct outreach sales, or hand out free samples. Some countries have implemented the code in full, and others to a greater or lesser extent. Still others, however, have introduced no regulations at all. Countries with weak or no regulation are attractive to the formula industry because the companies can operate more freely. In countries where regulation is strict, the assortment of infant formula is smaller and products are more discreetly displayed in shops. Health workers rarely promote products because it is prohibited by national law, and the authorities will impose sanctions on violations. The rules are designed to save babies' lives. When companies violate these rules, they're putting babies' lives at risk.
Some of the violations include promotion of the product in some health centers, in many of the pharmacies, supermarkets, baby stores. You see infant formula throughout the whole shop in some instances.
When I was 5 months pregnant, I went to one of the clinics to do the ultrasound, and I got pre-sample from the staff there, and it was a bag and the container of the formula, and the staff just gave me information about.
Summary of the code. Ban the breast milk substitutes public advertisement. Free samples from mothers is not allowed. Marketing in health institutions is not allowed. Companies' staff are not allowed to give advice to mothers. Healthcare staff should not accept any gifts or free samples from the company's staff members. The companies are not allowed to put healthy or happy babies' pictures on the products' labels. Breast milk substitute products labels should mention clearly the advantages of mother's milk against breast milk substitutes.